Well, when we talk about the younger kids, and especially in this like 11 to 15-year-old range, we've all heard the phrase growing pains. And we all know preteens and teenagers can be a bit whiny. Like that's just, we know that. But as parents, how do we know what's normal and what's not when a kid is complaining about something hurting? How do we, I think another way to ask it might be, how can we tell the difference between just whiny teenager and like something actually going on?
Yeah, it's a great question. There's a few things that are always red flags that we consider to be red flags, and one of them is pain that wakes you up in the middle of the night. Now, growing pains tend to be growing pains that maybe you have a hard time getting ready to go to bed, prior to bedtime, in the evening, you might have some aching and so forth. But if you're waking up in the middle of the night because of pain, that's a red flag. You shouldn't, if you're sound asleep, you shouldn't wake up because of pain. And that's something that, we'd want to investigate, more closely. The other one I always think about is when sort of activities that they commonly do, they just start avoiding because they don't want to do them anymore because the pain really prevents them from doing that. I'll see lots of kids that tell me, well, I hurt when I do this or I hurt when I do that. And I'm like, well, do you still do it? And they're like, well, yeah. That's a little less worrisome to me. If you're continuing to be able to do the activities that you do on a daily basis, then I'm not as worried. Um, so those are two big things. I mean, we could go down another whole other path of losing weight and you know uh, you know crazy stuff that can happen with tumors or infections like fevers and chills and all that sort of stuff. But the two that I think come most commonly to me, I'm like, I need to investigate this further. Are do I wake up in the middle of the night out of a deep sleep because I have pain? Or the other big one for me is if I stop doing activities that I tend to do every time and I really enjoy. That's the key is like if they stop doing that, then there's something really wrong. Um, but if it's they do the activity, they continue to do the activity every day, and they jump down at the dinner table and they're like, my knee hurts or my heel hurts or what have you, then I'm like, well, are you still able to keep playing and doing? Oh yeah, absolutely. I don't want to stop. You know, that gives me a little reassurance.
On that front, I'll give you a story. My 8-year-old this past soccer season, I noticed he stopped running a ton during games. And we couldn't figure out what it was. Me and my wife actually noticed it the same game, and she noticed him limping off the field, and he kept pointing to a spot on the bottom of his foot that was hurting. And so we're like, maybe it's the cleats. Maybe he's like, even though he hasn't, there's still a little bit of space there. Maybe he just needs a new pair of cleats. So we went and got him a new pair of cleats, and it seemed to get better, but there were still times where his foot hurt him while running. He has terrible run form. I'll be the first to admit that. Like again, he's 8 though. We're talking about earlier, just letting kids play before worrying about form. So, and he's also a bigger kid. He's like me. He's going to be the kid that grows faster, and just the way that he is. And I mentioned next week I'm talking to Farrell Frankel, who's a nutritionist, and in the interview I'll tell her it's like he's been in the grow wide before growing up phase for a little bit because that's how kids grow,
Yeah.
and so how do we know the difference between something like his foot just hurts because he's growing and he's maybe a little too big for his bones right now versus like, is it the shoes or is this an actual injury? Like as a parent, like I don't want to rush to the doctor every time my kid has a little bit of a hurt, but I also don't want to send him out on the soccer field if something's going wrong.
Yeah, I mean, I think you had a great intervention, which is try simple things and changes. Change his shoes, and if that helped, then great. Reducing that activity a little bit, see if it goes away. I think the things that you worry about is if things are progressively getting worse with that reduced activity instead of getting better. That's something you need to be more worried about. If it just doesn't go away. I think that's a reasonable time to, if you've tried it and 3 to 5 days go by, you've made some reduce the activity a little bit, made some changes with whether it's equipment or shoe wear or what have you, and you don't see it reducing or it starts getting worse. Then I think those are the things that would prompt me to go in and have a deeper evaluation. Um, But yeah, I mean, I think what you did is exactly right. Just change it up a little bit. Not necessarily completely rest and decondition, but change the activity up, reduce the intensity of the exercises, maybe change some shoe wear, see if if there's improvement there. And if there is, then great. If there's not, and it's persisting and doesn't go away or starts to get worse, then I think it's valuable to go ahead and get a more deep evaluation.